not able to reach a resolution.
You're going to do an open admission? Did he sign a form?
He did not. Do you want to sign or do you want to
I
do
want
it?
him to read the form. I want him to read the form and sign it. Take your time, make sure you understand things, and if you got a question about it, you ask me.
Before we do that, I have remarks and things that the state has also reviewed. I just want them to be put as evidence as the fence. I think there's 6 exhibits maybe. I know there's more pages.
Stipulate, Judge.
There's 2 letters that maybe you could look at, and then some proof of class attendance. So if you want, okay. He's right. He's got everything. Sure, what's the max on this?
We had a first 30, 30, 60, 65, 70.
Let's say it's
Yeah, it's over 80 when you add the misdemeanors and the violation. Let me get you first.
All right, state your name.
Colton Phillips,
What's your highest level of education?
high school diploma.
Are you under the influence of anything today?
No, Your Honor.
All right. In a violation of probation, you are entitled to have a hearing in front of a judge. State has to prove that the violation is willful and substantial on your part. They need to prove it by the preponderance of the evidence. That's the legal standard and beyond a reasonable doubt. If you are going to be admitting today you're doing at that hearing, you understand that?
Yes, Your Honor.
Okay. All right, now, when we say you're doing an open plea, that means there's been no promises made to you, correct?
Correct.
Okay. So you don't feel that any promises have been made to you from the state?
Correct.
And you don't feel like there's anything that I may have said or done that made you think that I made you a promise or that I would do one thing or another?
Correct.
All right, so you're not coming into this, and nobody's made you any promises, correct?
Yes, Your Honor.
And you understand what the potential consequences are?
Yes, sir.
You know what the maximum sentence is?
Yes, Your Honor.
I mean, you guys wrote 80 years on there, is that 80 years plus?
It's 151 years, I think, Judge, plus the violation.
151 years?
Plus the violation.
Okay. And you score 188.
It's
That's
15.
15 years and 8 months, right?
That's not, yes, sir.
All right. Okay, so you understand all that, right?
Yes, Your Honor.
All right, now, if there's not a reinstatement, if there's not a reinstatement, the only way I can go below that lowest permissible sentence of 15 years is effectively if you can prove up a downward departure basis. And even if you prove up a potential downward departure basis, I would not have to accept it. So you understand all that?
But Judge, I'm sorry, I would, on a violation of probation, you could sentence him for whatever you like, the guidelines are just guidelines.
Well, if I'm not reinstating. No, I think I'm stuck with the guidelines if I'm not reinstating. Aren't I stating?
Well, I guess I'm.
See, I'm stuck with it. See, I'm still stuck with the guidelines. Otherwise, we wouldn't even be doing the score sheet. I mean, I'm stuck with the guidelines if there's not a downward departure basis, or if I'm not. I don't have to do it. I don't have to have a downward departure basis to reinstate. But if I'm not reinstating, I have to have a downward departure reason not to give the lowest permissible. That's my understanding.
Yeah, except in this case, the downward departure reason is already, I guess it's already established by virtue of the downward departure.
Well, the downward departure basis was an agreement with the state. I'm assuming we don't have that here.
You don't have to agree with the state, you do have the grounds for the downward departure. I wouldn't be prepared to necessarily prove things with the state, with the stipulate things like substantial assistance.
You stipulate to that state?
Well, the substantial assistance downward departure was on the initial case. For the BOP, we don't have, no, the BOP downward departure basis, I thought was gonna be the medical doctors and stuff you have.
I
That's
think
the
that now we would go back to the reason for the underlying charge, which was.
And cooperate with the state to resolve the current offense or any other offense.
That's the current offense, so it applies to the initial case. Now, it's different for each score sheet. So when we come back on a BOP,
Or any other offense. And cooperate with the state to resolve any other offense. So why would that apply today?
because we didn't have that agreement, we don't have an agreement, so we don't have a
Well, you
stipulation.
prove that up, right?
Yeah, I thought he was gonna bring it up with
You
the
ready
medical.
to prove that up today?
That we cooperated, other than the documents in the court file, other than.
Well, there was an agreement that he would do that, but I don't think that there was any testimony as to what he actually did.
We're not contesting that you cooperated, that was clearly the reason for the first downward departure.
No, you don't have to agree that you give him that downward departure. I'm asking whether or not, because he has to prove anything up, to prove that he helped with other offenses.
No,
But you don't have to,
yeah,
okay.
we're not contesting.
You're not agreeing to the downward departure, but you're not disputing the facts that he
Yes.
supplied substantial assistance.
Yes, I would say that exactly, Judge.
Okay.
I would clarify, it ends up in a similar.
Better to know that now. So there is a downward departure basis, but that doesn't mean the court has to accept it.
Of course, right.
Okay. All right, so Mr. Phillips, did you understand the conversation you just had?
Close.
If not, you need to tell me that you didn't understand that.
Let me explain. It's basically cool, if I may, Judge.
Go ahead.
Every offense is rated 1 through 10, you get certain points, they add up, and then there's a math that you do, and that gives the judge a guideline score of, this much or up to whatever the max is. In your case, that number is 14 or 15 years. There's ways to go below it. One of those is through, there's like 10 or 11 different ways you can do it. Originally, there was one of those that means the judge could give you the original offer, the original deals you got, which was probation. What we were discussing is, could the judge do that again here today? And I was saying, I believe the judge can give you anything he wants, from reinstatement all the way up to the maximum, because we've already checked that box when we did the plea way back when in 2018 or 2019. And the states agreed that yes, that condition existed, but not that it applies today. So the state can ask for from 0 to 100-something years, and the judge can give you from 0 to 100-something years. But the judge doesn't have to give you the 15 years that's on the score sheet, because there's a check mark in a certain category of things that lets you go below. You understand that?
I understand, Your Honor.
Okay. All right. Okay, one other thing I want to let you know too is this. When we were having a discussion earlier, it sounded like Mr. Delgado had spoken to you about potential, I guess, constitutional issues relative to the violation or the allegation of the violation. Now, effectively, if you're doing this open admission, you're effectively waiving that on appeal. So if you went on appeal, you wouldn't be able to claim that, hey, I had a constitutional issue here that we didn't, we actually did not litigate. Okay, you understand that? You're basically giving up that argument.
Yes, Your Honor.
Okay, and I'm assuming that's one of the things that you guys discussed.
Yes.
Okay, all right. Okay, so you got any questions for me?
As of right now, no.
Okay, so as to violation of probation, do you wish to admit or deny?
Admit.
I find that your admission is known and involuntary. I'll accept your admission. And I'll now go ahead and take testimony relative to what we need to do.
Just can I give you a brief overview?
Yep, go ahead.
Judge, when Mr. Phillips originally violated probation, it was an unusual circumstance where the Shores arrested him on a violation of probation and then ROR'd him did not contact his probation officer. The violation of probation report that the court has in its file shows that Mr. Phillips self-reported to his probation officer, informed of the contact of law enforcement, informed of what had happened, was kind of admonished by the probation officer. Probation's recommendation is to reinstate him to add a curfew for 6 months. So Mr. Phillips came forward, voluntarily admitted the wrongdoing, contacted probation the first, I think it happened on the weekend, he contacted him on Monday, he emailed him over the weekend and contacted him that week. So he was forthcoming and admitting his wrongdoing, and he told probation, I screwed up, in terms of those things. Since that time, if you can speak with me, Mr. Phillips and his family have basically expressed that Colton doesn't he was doing things that he couldn't really even understand why he was doing them. He was isolating himself over periods of depression, coupled with periods where he was, kind of euphoric. One minute he'd be very serious about working, the next minute not so. So we immediately undertook to kind of find out what was going on. He has been and continues to see a therapist weekly. You have a report from her. We put in evidence. Judy Stamper. He's seen her, I think 5 or 6 times since his violation of probation, and she has an opinion that is in that letter. He's also been doing substance abuse counseling, at least weekly, through an online program called Smart Recovery, which is like an alternative to AA or NA. One of the reasons that we selected that is because it allows kind of automatic reporting he's attended, so you have the verification form to show that he attended those meetings that are kind of done automatically. So we thought that was a good way of showing that he was there and all of that. But most importantly, Judge, he went to see a psychiatrist, Dr. Ali, who's in court today, will testify. And Colton's 24, 25, when all these troubles began, he was a little younger, but the violation is 25. And that's a very important age because Dr. Ali will tell you that he's diagnosed Colton as bipolar, second degree or type 2. And he says it's very common at this age, if you have bipolar conditions, you're going to start to manifest it. And he will explain to you what he's seen from working with Colton, that this is pretty much, right along with the traditional presentment. Colton is being prescribed Abilify, and has been taking it now for I think about a week or 2 weeks. We've just started. And the doctor will tell you he said it takes 4 or 5 days to get it up to kind of a therapeutic effect, and the plan is to titrate him up as he tolerates the side effects, so it gets to the point where it has a desired effect. And he'll tell you his opinion is Colton has an illness and is sick. That essentially he was an undiagnosed, unmedicated, unregulated bipolar without the appropriate medication. And this is something new that's just come into his life, and it kind of answers a lot of questions know him as to why he was kind of doing the things he was doing. The doctor will tell you that even in the time of the first meeting with him, the second meeting with him, before Colton started the medication, he noticed a significant change in his behavior for the worse. And he said that's consistent with what you would expect at this age and kind of present with this medication. This is not a late diagnosis in the sense that it's the first time anyone's formally diagnosed him, but Colton struggled throughout his life with the doctor. Ali has reviewed medical records and school records going back to kindergarten with diagnosis of attention deficit disorder and other kind of comorbidities that are consistent with what you would expect by the time he's 25 and have this condition. And Dr. Ali told me something I thought was really excellent insight. He said essentially left untreated bipolar mania always ends up either in jail or in hospital. And that's sort of that's what he saw happening here. And it's our hope that with time and treatment, that will be a fate we can avoid for Colton. So that's the evidence that we intend to present today, as well as Mr. Phillips would like to address the court. But if I can just start off by calling, we're only going to call two witnesses, Dr. Ali and then Colton Phillips. But if I can just call Dr. Ali, appreciate the judge.
All right.
You can testify.
Stand. Yeah.
Yes.
Good morning, sir. Could you state your name for us, please?
Tarek Ali.
And sir, what is your profession?
I'm a psychiatrist.
And can you give me kind of a brief overview of your education and experience up to this point?
Sure. I went to Ross University School of Medicine for my medical doctorate, and then I did my residency at Newbridge, Bergen Regional Medical Center, New Jersey. And then I did a fellowship in child and adolescent psychiatrist at Boston Children's Hospital, Harvard Medical School.
Okay. And what areas do you focus, and now you have your own practice in Ormond Beach?
Yes.
What kind of areas do you focus in, or like do you limit your practice to some type of treatment or type of patients?
I'm dual boarded in adult and child and adolescent psychiatry.
Okay. And did there come an occasion for you to meet with and ultimately begin treating Colton Phillips?
Yes.
And can you tell the court about that?
So, first time I saw Colton was on September 1st, and initially it came in with the chief complaint of, really quote, I want to know what I take, if what I take is good enough, and I don't know why I keep doing the things that I do, I need help.
Okay. And did you understand that Mr. Phillips had some legal problems at that time? Or did you come to understand that?
I came to understand that afterwards.
Okay. And then what, I guess, did you do some of that? What was your process at that point?
Sure, I did a psychiatric evaluation for Colton, and I found that I definitely saw a history that was concerning for not just the diagnoses he came in with, which was various learning disorders, but also ADHD. But I saw concern that there were possible hypomanic shifting that could be indicative of a bipolar disorder. So when I discussed that with him and getting the history over time, the plan was to build rapport with him, build a therapeutic alliance, and be able to start treatment with that.
Is it common for people to kind of reject or recoil from a diagnosis of something like that, especially at that age?
Absolutely.
Okay. So that's why building rapport is important?
Yes.
Okay. Did Colton seem to have an insight into kind of why he was doing what he was doing? I know that was his chief complaint, but did he have a lot of insight or no?
Limited insight as to the specifics, definitely insight as to know that something was wrong, that he was having depressive episodes and the energy episodes and the symptoms that he was reporting. But as to the specifics of a diagnosis, no, we weren't there yet.
Okay, did you review records from other medical practitioners or mental health practitioners like Dr. Stamperer and his grade school records and things like that?
Yes, I reviewed the psychoeducational testing for 3 different grade levels, and then the letters that his therapist and his primary care physician wrote.
And did that help you in formulating your diagnosis?
Yes and no. It definitely helps substantiate the ADHD and the processing speed issues that he had historically. There was a report that his therapist had concerns for bipolar disorder, but that wasn't in the letter. I found that there was definitely a pattern of that.
And what age, just kind of speaking generally if we can, I told the judge that one of the things you told me was about the kind of the age of onset, I don't know if that's the right term, but when does someone, if they have this propensity or this condition, when does that begin to manifest?
The most common ages where in a male that this a bipolar manic or hypomanic shift would occur would probably be between the ages of 18 and like the mid-20s. The most common age is 25.
Okay. And that's Mr. Phillips.
Yes, sir.
Then did you have did you come to a formal diagnosis? What is that diagnosis, and then what's your plan of treatment?
The initial diagnosis that I gave him was an unspecified bipolar and related disorder, meaning that I didn't really quite have enough information to diagnose him with bipolar disorder during the first visit, but I had a lot of concerns. At the follow-up visit in November, that's when I gave him a formal diagnosis of bipolar 2. And I also carried the previous diagnosis as well as the ADHD.
Okay. And so what are the hallmarks of bipolar disorder 2?
So someone with bipolar 2, they will have depressive episodes and they will have what we call hypomanic episodes. Hypomanic episode is a very distinct period of time where the mood is elevated and expansive or irritable, 4 days usually consecutively, and then there's a very prototypical symptom range. They need 3 of the following, which is usually grandiosity, a decreased need for sleep, hypertalkativeness, flight of ideas, distractibility, increased goal-directed activity, but also participation in behaviors that are considered like more risky, including sexual behaviors, business endeavors, or substances.
And you had told me that, like, kind of left. If someone doesn't treat their bipolar disorder, is there a prognosis that you would expect?
It's guarded. I mean, there's different trajectories. I can't really speak to that as much for Colton. I think it's a testament to his resilience for him to be coming back and to gain insight from the first time I've seen him to now.
And now he is prescribed like a psychotropic medication?
Yes, so the second time I visited him, the first time the therapeutic alliance really wasn't there to start him on a new regimen that was different from what he was on previously. During the second visit, Colton was much more proactive in seeking treatment and trying medication to help him with these shifts between depression and hypomania. So I prescribed him a medication called aripiprazole, which is an atypical antipsychotic used for mood stabilization.
Okay. And about how long would that take to kind of, for like, non-scientific term, kick in or start to have an effect?
Usually between 4 and 5 days.
Okay. And then is this something that if the person's being compliant, and I know compliance is always an issue, is something you would take every day for the rest of your life?
Yes.
So it's not something that you take as needed. This is a commitment.
This is a commitment.
Okay. Does it come in like preparations that are long lasting, or do you have to take a pill every day, or how does that?
As it's prescribed now, it's a nightly pill, but there are injectable formulations that can even last up to 2 months.
Okay. And I guess you haven't settled on a dose for Colton yet. You're still working to see what he can tolerate, what he's needed. Okay. So. Ideally, what would be the course of treatment going forward? How often would you see him? Things like that. What would be the ideal?
Ideally, I would see him at least once every 3 to 4 weeks.
Okay. For forever, for months, for a year?
Well, I mean, it would really depend on his stabilization. It depends on the dose he gets to and whether or not he can go back to his primary care physician for that. But in my practice, we do both psychopharmacological management, so just medication and therapy. But he also has an individual therapist.
Is having like kind of individual therapy, is that an important part of treating the bipolar disorder?
Absolutely.
Okay. So he's seeing you as a psychiatrist, physician, doctor, but he's also seeing a therapist kind of offer that less medically guided counseling.
Yes.
Okay. And then you're aware of and have reviewed records for that counselor as well?
The letter is.
Yes. I mean, but you said you're aware that he's been going?
Yes.
Okay. And would you say that going once a week, is that Is that good, bad, less than ideal? And yet, as far as talking with a therapist, what would you recommend? What would your guidance be?
I mean, I think weekly therapy is a standard of care, but really that depends on how he's doing and the relationship he has with the therapist.
Okay. You said you saw a marked change in Colton Phillips from the first time you met with him to the second time?
Yes.
Okay. When would you hope to see like positive improvement from the medication? Like in a month, in the next couple meetings? What does that process look like? The titration and all that, what would that look like?
So he was started on a 2 milligram dose, which is under the therapeutic dose. I started that to make sure that he wasn't having side effects and to make sure that this was a medication that both he needed, but also something that he was hoping to take for his own, improvement. So I would probably optimize every visit based to find the lowest effective dose for him.
So from 2 milligrams, what is, is there kind of an average dose that people settle on that you can say like it's 8 or 10 milligrams or?
Well, with bipolar 2, it can kind of range pretty drastically, but I would say probably between 5 and 10 milligrams.
Okay. So he's probably less than half of the way to where you would hope that he could end up tolerating.
Yes.
Okay. And is he responsive to you? I mean, is he amenable to treatment?
Yes, very much so.
Would someone who has the bipolar diagnosis you have, would they have lacked kind of insight and maturity, as we use the term, in their daily lives? Is that something that you would have expected to see? The kind of, I guess in this case, Mr. Phillips went to a bar while he's on probation, had a beer while he's on probation, kind of no thought for the consequences. Is that consistent or inconsistent, or can you tell someone who has a bipolar disorder?
So I'm not a forensic psychiatrist. I can't do I didn't do a forensic evaluation. I can't speak to his state at the time. But there is, in the course of the illness, there are definitely moments where insight is poor and impulsivity is high. There also is the timeline that this could be getting worse as time has been passing. So it is possible that now that he's getting treatment, that things are improved drastically in terms of those kind of behaviors. But as for what was going on back then, he wasn't my patient at that time, so I can't really speak to that.
And then as a criminal defense lawyer, you kind of bump into a lot of, mental health issues, some of your colleagues, some of your clients. But one of the things we always kind of hear, and maybe it's just pop psychiatry, is that people who have bipolar disorder self-medicate or tend to self-medicate. They use alcohol or depressants or stimulants to kind of balance. Is that an accurate statement? That some bipolar people will kind of self-medicate, lacking, maybe they don't know they're bipolar, they just know that when they use these substances, it kind of mediates how they feel.
That is a pattern seen with some patients.
Okay. Is alcohol one of those substances that's used as kind of a self-treating mechanism?
It's common for patients to self-medicate with alcohol.
Okay. And then, and I guess one last question, at some point, would the injection be appropriate for someone in Mr. Phillips' condition, or is the injection used more for people who are at a different dose or something like that?
The dose would be 5 or higher for one of the injectables, and it's appropriate for any patient on the oral medication.
Okay. And how long does the injection last, approximately?
It depends on the injection itself, anywhere from 1 month to 2 months, depending on the medication.
Okay.
The dose.
And that's done partly probably to improve success with people actually taking the medicine?
Yes.
Okay. I don't have any more questions for this witness, and I'm attending this.
All right, Thomas?
I don't have any, Judge. Thank you, Doctor.
Okay, thank you so much.
Thank you. Thank you, Dr. Patricia.
Who else did you want to call?
Just Colton Phillips, Your Honor.
Okay.
Where do you want him to?
If it's going to be a while, we can sit down and talk from there, or if it's going to be short.
I don't think I'm prepared for long.
Okay. All right, we're still under oath. Go ahead.
Sir, you say your name?
Colton Phillips.
Mr. Phillips, let's kind of go back to the decision that put you here. what do you want to tell the court about your decision to go and have a drink at that club and that whole process? What happened?
Well, I had depression building ever since the last year or two, after my first arrest, and I didn't realize it, and I had been prescribed some medications that I possibly had mixed when I chose the horrible decision to have a drink, and it made me make some really bad decisions that night.
And as far as your depression, you were close to your uncle, right?
Yes.
He was the one who kind of took you under his wing, showed you how to do some of the family business, things like that, right?
Yes, I've been suffering from that loss pretty dearly.
And he passed away relatively recently.
Yes.
And that was before this incident, before your violation of probation.
That's correct.
And that affected you.
Very harshly.
Did you get the sense that were you happy? Was everything normal in your life, or were you struggling with other issues? I know you said that you were depressed, but did you kind of know that things weren't right with you, or?
Certainly, I was starting to become unhealthy. I was starting to lose weight.
When you were arrested, or when you entered your plea in 2018, 2019, do you remember how much you weighed?
Yeah, around 195, 185,
How much do you weigh now?
about 150.
Okay. So you've lost about, 40 pounds in the last, year or so?
That's correct.
Okay. And so now, after you were taken home by the shores, and that weekend, did you contact your probation officer?
Yes, I did, immediately.
Okay. And then did you go and report to your probation officer for that week?
Yes, I did.
Okay. And did he make it clear to you, no bars means no clubs of that type, and no alcohol means no beer, nothing here?
Yes, he did make that clear.
Okay. And then, did you begin going to any kind of substance abuse treatment classes?
Including the two therapists, the Dr. Ali that I've been seeing, have also been attending some behavior therapy classes that I
That's
attended.
a recovery class?
Yes.
Okay. And that focuses on kind of, you can use it for drugs, alcohol, or just kind of maladaptive behavior in general.
That's correct.
And you've been averaging about 1 to 2 meetings a week since your violation, or since October?
Yes, I have.
Okay. And then some of those meetings, you can get a kind of an automated thing to say that you were there.
Yes, a verification.
And those are the forms you gave the judge, right?
Correct.
Okay. And now you've also been seeing a counselor, Ms. Stanley. Is that correct?
Yes, she's been helping me a lot with the loss of my uncle and multiple other areas of my life that caused me to go down this path.
And then you also were seeing Dr. Ali, you just testified on the
Yes, correct.
Now, when you first went in, you first talked to him, and did he mention the idea that you might have a bipolar condition?
Yeah, I was very open to hearing what he had to say because I was kind of losing myself at the time. And he had really gave me some good information on why my brain is acting the way that it's acting. And we decided to try out Abilify, which is the medication he prescribed me.
And how long have you been taking Abilify now?
I just recently got the prescription and just recently took it.
Has it been more than 4 or 5 days?
It's been about 4 days.
Okay. All right. So are you agreeable to continue to take the medication that's prescribed to you?
I'm willing to try anything to improve my behavior.
And are you willing to continue to go to the therapy with Ms. Stanford on an as-needed weekly or more basis?
Absolutely.
And then are you willing to continue to do some sort of either behavior or drug or alcohol classes on a weekly or more frequent basis?
Absolutely.
Okay. One of the options the judge has is jail, prison, community control, which is a form of house arrest. Do you believe that you could follow a tight schedule that you agree upon, like 2 weeks at a time, be where you're supposed to be, otherwise be home or be at work?
Yes, I think I could do that.
I guess what I brought up work, are you working now?
Yes, I'm working multiple times a week. I'm doing people's driveways, and I've had a lot of very happy customers. And
So let's clarify that, because it's not like you just pick and go when you go to work. You have your own company, right?
yes,
That does like smaller paving jobs, like residential driveways, things like that.
correct.
Okay. So those are things where you have to get a customer to do a job, and then, you don't necessarily have work every day.
That's correct. I don't have work every single day.
Okay. But as your business grows, and eventually you have work every day.
Yes, that's correct.
Okay. And what else do you want to let the judge know about, why should he give you a chance to not go to jail or not be, punished more harshly than, community controllers? Why should he take a chance here on anything?
Well, I think I made a bad decision to grab a drink. I think the depression underlying really had played a factor in it. And, I'm willing to do anything here forward to better myself and make sure that I continue to take my medication, continue to see the therapist, and better my life.
I don't have any further questions.
Ms. Thomas?
Just briefly, Judge. Mr. Phillips, on April 4th of 2019, you remember entering a plea in this court to 15 years drug offender probation,
Yes,
and you met with a probation officer to go over the conditions of that probation that you had to follow as part of the plea.
yes,
Okay, you were instructed that you were to have no drugs or alcohol while on the term of probation.
yeah, I didn't know if it was in excess or if it was just not all. I wasn't completely grasping my head around that until now.
Okay, you signed paperwork that would have those conditions laid out, right? You initialed the paperwork.
I believe so.
Okay, and you were also told that you weren't to be in any type of bars or establishments that served alcohol,
That's correct, yes.
and you signed that paperwork as well?
I did.
Okay, and then on August 28th, 2021, you did have contact with law enforcement at Biggins Gentleman Club here in Daytona Beach, right?
Correct.
And you continuously said during your testimony you made a mistake when you grabbed a drink. You would agree with me you were intoxicated that night?
I wasn't intoxicated. Say I, maybe it collided with the medication I was taking, that I was prescribed, and that could have made my brain spin in a not so good behavioral way.
Okay, I think you mentioned the officer Xanax. You were taking Xanax?
That's correct.
And you know that on the pill bottle, as I'm sure you were instructed by your doctor, you're not to mix that with alcohol, right?
That's correct.
Okay. You said you had a drink, you grabbed a beer. You had more than one beer that afternoon, right?
No, I had one beer in the club.
Okay. You're aware that police officers found alcohol in your truck? And that alcohol belonged to you, or did that belong to somebody else?
It belonged to me. None of work.
All right, I don't have anything else, Judge.
Anything else? During your probationary period, were you driving with your license suspended?
Yes, I paid the fine, and
How long was your license suspended?
I'm not sure, to be honest, Your Honor.
Now, let me ask you this. Other than the time you actually got caught driving while your license was suspended, were you driving on a suspended license on the other days too?
Can you repeat that again?
All right. Other than the day you got caught, okay, did you also drive on a suspended license during your probation?
I believe so.
All right. Okay. I understand that's not part of the affidavit. I just seen if you didn't tell me the truth. All right.
Did you know your license was suspended the entire time that you were?
No, I had no clue. I went and paid the fine and didn't read the paperwork closely enough. It was completely my fault. And, ended up getting pulled over. I didn't realize why I was pulled over until he told me.
But then once you got pulled over, you did get your license reinstated almost immediately, right?
Yes, correct.
But you do admit that you would have been driving without a valid license at some point on probation, like the judge.
Correct.
Did you have a follow-up to that?
No, Judge.
Okay. All right, did you want to call any other witnesses?
No, Judge, it's okay.
All right, State, did you want to call any witnesses?
Yes, Officer Detish, where is the council name? With Daytona Sheriff's Judge. Do you solemnly swear or affirm the testimony you shall give this cause is the truth, the whole truth, and nothing but the truth? All right, good morning, officer. Thank you for being here. Where are you currently employed, ma'am?
City of Daytona Beach Shores,
How long have you been there?
approximately 3.5 years.
Okay, and I'm just gonna kind of skip right to it. Through the course of your employment there, did you have an occasion to come in contact with the defendant, now known to you as Colton Phillips?
Yes.
You see him here in the courtroom today?
Yes.
All right. Can you identify him for the record? Thank you.
All right.
So I want to talk to you about August of this year when you had contact with Colton Phillips. Can you kind of give the court a little background as to what you were doing on that night?
I was conducting proactive patrol in the parking lot of Biggins Gentlemen's Club.
Had you done that before?
Yes.
Okay, what does that entail?
I typically do property checks and bar checks every night in my zone, and I run the license plates in the parking lots that I drive through, and I make sure that no one's got warrants, stolen vehicles, probation violations, that sort of thing.
Is the establishment aware that you do that?
I'm sorry?
Is the establishment there aware that you do
Yes,
that?
yes.
Okay. Do you actually know the owner or the manager, or the manager?
I do.
Who is that?
The owner is Joel Knight, and the assistant manager is Shane Reinhardt.
Okay. How did you come in contact with Mr. Phillips that night?
I ran his license plate while his vehicle was parked in the establishment, and I noticed that there was an FCIC, NCIC hit for probation. One of the conditions was no bars or alcohol. So I called for a second unit so I could go investigate. I was actually going to go into the bar and try and locate Colton, who I identified through his Florida driver's license photograph. And I don't know if you need any more.
That's okay.
Okay.
All right, so what happened when you made contact with Mr. Phillips?
I contacted him while he was leaving the establishment.
Okay. Judge, I think the best evidence would be the video. I know, Mr., do you want to stipulate to the video? Or you're going to
Yeah, I would be the way the predicate, Judge.
Okay. I just want to publish it then, Judge, it's for access on
Put it in,
video.
put it in evidence,
Yes, I already have it pre-marked. If the clerk would just mark it
and
as.
put it in the state's one, Madam Clerk.
Thank you. Oh. Now, officer, you're wearing your department issued access on that night of your body camera.
I'm sorry?
Were you wearing your body camera that
Yes,
night?
yes.
You had opportunity to review the footage?
I have.
Okay. I might have to move this. I can move it this way.
Okay. So, you're on probation, right? Okay, keep your hands on your pockets. I understand you might be a little bit intoxicated, so that might be a little bit hard for you to understand. Okay? You're on probation. What are the conditions of your probation? Listen, look at me. If I'm asking them, I already know them. That's why I'm talking to you. So what are the conditions of your probation? You're not supposed to be drinking. You're also not supposed to be at bars. Keep your hands on your pockets. Thank you. So, you're not supposed to be at bars. So you're gonna hang. So that's fine. Hang out with this officer. I'm gonna go talk to the bartender real quick, and we'll go from there. But you already can't as of right now. Hang out with this officer. You go with him, get his name, date of birth, and then you run that out. The voice is already in the call. Hey, was he inside? Was he one? Yeah. Was he drinking?
Yeah, one beer.
Is he problematic at all?
He's perfectly fine, sit there, hold his phone a few times, got some respect fees. We already determined he's going to get a beer.
Okay.
After he's there, drink beer. No problems, left.
Yeah, I might need a receipt.
Okay, I don't know if they cash or not.
Okay.
We'll be receiving the cash.
Okay. Even so, well, just in me, here's a violation of his probation.
Oh.
So,
Okay.
yeah.
Well, that, I mean, you can video that.
Okay.
Shoot a screen.
I'm gonna get with Penn, but he's on probation, and he was.
Yeah, that's all. He wasn't acting that way? You want to know today?
Yeah, I came to the funeral my first day back. Yeah, this is my first day back from school.
Okay.
Okay. Well, yeah, I was thinking I'm gonna go DUI route, but you probably DUI if you walked out or out here, so I'm gonna get with my supervisor, we try to tell. Okay. Okay, well, I'll get you when you need. Thank you. Thank you. Can you please keep your hands on your pockets, man? Hi. So,
Unless you want me to play the rest, Mr. Delgado, I'm fine with that, Judge. I just wanted the initial encounter and the video for the defendant.
Okay.
Unless the court or Mr. Delgado wants the rest played.
No, but I'm good.
Okay. All right, so when you first had contact with Mr. Phillips, actually, let me back up. Are you trained on detecting and apprehending people who are intoxicated under the influence of alcohol or narcotics?
can you clarify like
As
DUI?
part of your job, are you trained on detecting or apprehending people who are under the influence of alcohol or narcotics?
I am, I just want to clarify, I'm not a drug recognition expert.
Okay, we can focus on alcohol, okay?
Okay.
Have you attended classes or courses that's given you the ability to make those determinations?
Yes,
Okay. When you first had contact with Mr. Phillips, did you notice anything about Mr. Phillips that led you to believe that he was intoxicated?
yes.
What type of things did you notice?
His inability to follow simple commands, his slurred speech, his bloodshot eyes. He stumbled when he got out of the truck and it looked like he was leaning against it for balance. And his slow, delayed reactions.
Okay. And while you were on scene, I know you didn't give him a citation for DUI or anything, but did you make a determination that he was intoxicated?
Yes,
Okay. Your observations that night, were they relayed to the fellow officers that were with you there on scene?
yes.
Okay. Ultimately, what did you decide to do with Mr. Phillips?
I decided to cut him a break and get him right home.
Okay. Let's talk about the probation violation. You stated on the video that you knew he was on probation. You told him that as well. What, if any, actions did you take with that information?
I made the felony arrest and then released him on his own recognizance.
Okay, and what was that for?
Violation of probation.
Okay, and at the time you did that, what were you basing that on?
The belief that he had consumed alcohol and was at a bar-type establishment.
Okay, and at the end of the night, what did you guys physically do with Mr. Phillips?
We drove him home.
Okay, what did you do with the vehicle?
I believe I had Shane Reinhardt park his vehicle and leave it at the bar.
Okay, all right, that's all I have for you. Thank you, officer.
All right, Mr. Delgado?